Due to the recent upsurge in COVID-19 cases from moderate to high-risk countries, there will be no relaxation of the repatriation requirements at this time. Chief Medical Officer Dr. Roshan Parasram explained that there are two national repatriation policies. One is where people entering Trinidad and Tobago from low-risk countries must submit a PCR test. Once negative, they will be allowed to quarantine at home for 14 days. But for countries listed as moderate to high risk, such as the United States, UK, and Europe, a combination of state and home quarantine is required. Dr. Parasram said easing the requirement for this category was being considered, but added that this country has to guard against the entry of different strains of the virus.
Upsurge in number of cases that have occurred, we were looking very closely at the international community to see if we could have eased on the moderate to high risk countries in terms of relaxing that and letting people quarantine at home. But with the recent upsurge in cases, it puts that possibility a little further down in terms of us going that way.
Dr. Parasram said there continues to be positive cases from repatriated individuals, and as such, he added it is critical to continue with the current repatriation policy at this time.
That out of 67 people that came back from US, 7 of them came back as positive when we did the day 1 or day 2 swabs. And we have seen, even in as recent as yesterday, someone coming in from Barbados and having a day 7 swab after getting a day 1 negative swab and turning out positive. So we're still getting positives from the repatriated individuals, and we are holding our quarantine orders for now.
Anyone returning from moderate to high-risk countries is required to quarantine at a state facility for 7 days, followed by an additional quarantine period of 4 days at home.